Hello and welcome everyone to the session on 4 decades in IVF, the Savior Saturday session for Voice of Healthcare. Let me first introduce the speaker to you, Dr. Hrishikesh Pai, awarded with more than 30 plus awards, including the prestigious
Hello.
Lifetime Achievement Award for Outstanding Research in Reproductive Health by ISSRF. Dr. Hrishikesh Pai is the Medical Director for Bloom IVF and the Administrator for Foxy Manyata Initiative. He's also the president-elect for Foxy 2022 and 2023. So, Dr. Pai, I think I'll start with touching on the topic. 4 decades in IVF, starting from a time when probably test tube babies was something that people were scared of, and then the birth of Louis Brown, Miss Kanupriya. And then today, when, everybody talks so openly about IVF, Bollywood is, actually promoting IVF so much. What do you think has really changed, both in terms of clinics, in terms of practices, as well as from a patient perspective? Do you see a change? Are people more accepting? Are people more open and vocal about it? How have things been in all these 4 decades?
So now I actually got my first exposure. First of all, let me thank you for inviting me on this platform. I'm really privileged. I got my first exposure in IVF when I was doing a housemanship in KM Hospital, where Dr. Indira Hinduja was trying to do her work, pioneering work in IVF, and there she had the first test tube baby in a very difficult setting, I must say. And we were many of us around her, who were her students, etc. We were quite inspired by her, and we all actually went into the field. And after working, she was my boss in 1984 when she had the first birth in the KM Hospital. And after that, in 1989-90, I went to Royal Women's Hospital, Melbourne, where I did my fellowship with Dr. Ian Johnson, who has had the privilege of having the second IVF baby in the world, first IVF baby of Australia. He was a
Right,
fantastic guy. And,
right.
in those days, IVF success rate was 5 to 10%. And one of my friend, Dr. Salim Daya from Canada, he always used to say that every year the IVF pregnancy rate will go up by 1%. So the one of the big changes that has occurred over the last 2-3 decades is that the IVF success has gone from 5 to 10% to 30 to 40%. So
Correct.
over the years, nearly 1% increase in pregnancy rate has occurred over the last 30 years. And now we are at hovering around 30 to 40% live birth rate. Live birth rate
Right.
means if 10 people undergo IVF, 3 or 4 will have a live birth. So that is the first thing that has happened. The change is that, and at that point in time when I came back to India and started IVF, there were only uh, 10 of us. Now there are 3,000 IVF centers. So
Probably there's
there was a
more, yeah,
there was an increase
there's
in
more
the number
people
of
have
centers.
learned. Yes,
Yeah, so no more people learned. We only trained them. A lot of workshops took place, and now it has become not an exception, but a standard norm. So
right,
the availability of services increased over the years. That was that. The technique increased. The technical skill not only increased, but the laboratory backups increased. More and more
correct,
equipment came in. Better culture media came in. Better
correct,
incubators came in, more
correct,
standardization of service occurred, more quality control, quality assurance came in. All these things came in. And then coming to patient attitude, the patient attitude also changed. Now it's a part and parcel of life. There's the
right.
only difference between the patients in India and the patients abroad is that in India, patients are more they are reluctant to talk about it openly, while in patients abroad they easily talk about it. So
Right,
that's the DNA difference between the
right.
two communities.
Yeah.
Like some of my
But do you
patients will.
still see, sir, a change between, let's say, 20 years back or 10 years back, how open people were about talking, that we have to undergo for an IVF or maybe there is a problem, versus today, that people can easily talk about it. The access is more, as you said. So do you see that also has changed?
That has changed a little bit now. People are
Little bit.
becoming more open about it. But still, like for example, one of my topmost patients, who is one of the biggest stars in the country, film stars, his wife phoned me and said they both are film stars. So he, please don't tell anything about us. But
Yeah,
had they openly told about their own battle, it would help so many other people. But
right,
look, so even though, so I feel that it's nothing to do with education. Knowledge and education are two different parameters. You may be knowledgeable, but
correct.
your attitudes and all is depends on a lot of other factors. So I still feel that in our country there is some kind of taboo. So they are now accessing the
Associate.
service, but they are not
Correct.
willing to tell about their thing so much. So I would say that 90% people are still conservative about expressing what they underwent, the treatment they had, etc. So they don't talk about it
Right.
much. It's a
Much.
compared to, for example, a cardiac bypass. You go to a
Right.
cardiac surgeon and get a bypass, then you'll talk about it to everyone.
Yes, it's
But you
openly
don't.
people can talk about.
Yeah.
Yes. So, and while you say that, from a 5% success rate, we've gone to a more than 35% success rate when we are talking about the, take home baby or the live birth rate. Still, India being a very fragmented industry, and, we have different kind of clinics, people practice differently in different clinics. We have, corporates on one hand, we have standalone, and we have small labs. So, what do you think, can be done to really standardize across the country? And while I'm asking this, I would want to know from you both the role of an embryologist as well as a clinician. How can they help in standardizing it so that this 35% can become even better? And, while the access is there, patients are getting similar kind of treatments when they go to the clinic. So, what do
So
you
the
think can really work?
So the standardization will come, either, it will come out of either ethical, drive from the patient, doctors and embryologists themselves, or it will come from in oversight, means laws and legal. So in our country, there is a new law that is coming, ART Bill 2020. I am one of the parts of the people who have framed it and contributed to it. So these once this law comes in, there is a lot of standardization that has come in. What is the size of this lab? What is the equipment which you need? What are the personnel? Who is going to do? All that has been laid down in the law. So hopefully with that and the practices that are involved, the algorithm that are there, all that has been incorporated. So there will be some kind of standardization, and with that we hope that we are always worried that with standardization it may come in a increase in the cost as well. So
Correct.
because you normally in our country we are like Robin Hood. Many times we cut corners to help the patient, but with standardization we will not be able to cut the corners. So in our country, because what we need to do, like in India, is to take the good things of the West, but not take the bad things. So we need to modify the bad things of the way the Western countries which they have undergone, so that we don't land up in the stage which they are in. See, the
Correct.
IVF cost of IVF is very high in the Western countries. So one of the reasons is because there are a lot of requirements which are there. Once the requirements come, then the demand is there for more spending. More spending will cause more cost to the patient. So
Correct.
it's an ongoing battle between quantity and quality. But at some point, it will stabilize itself. So with the ART bill, and already there is another skill development in our country.
HSCC, HSCC, and
Yeah.
that would have been my next question. So, with the HSCC really talking about the occupational standards and the ART bill now also talking about the pre-genetic testing, etc. What role do you think the government needs to play? So, while we are talking about the laws coming in, while we are talking about these bills coming in, but of course, implementation is a challenge. How will it get implemented? Who will
Yeah, but
implement? Will
the
it be the
network is already in place now,
yeah,
implementation, because the PCPNDT Act, which was promulgated for preventing sex selection and sex detection, the same. So the people who are involved in implementing the Nursing Home Registration Act or the PCPNDT Act, the same cadre of health care officials will be used by the government to implement this act as well. And so they are
okay?
a little bit already well versed with it. And what has happened is, but because of the implementation of the PCPNDT Act, we all are now any IVF center has to have an ultrasound machine. And if you have an
Yeah,
ultrasound machine, you come under PCPNDT. So we are already primed, so to say. We are
right, right,
mentally primed to follow the act. So I don't think it will be a problem in implementing the act. And we need a lot of skilled people. Already there's a lot of skilled people that are available. Once upon a
right,
time when I came back from Australia, I had to do
right,
the embryology part also myself. Now we
right.
have got a huge amount of number of embryologists available. In fact, during COVID time, I think there's been a lot of layoffs. So I keep on getting phone calls for jobs from the embryologists. So you had asked me a question about the embryologist. So
Correct.
embryologist is an integral part of the IVF laboratory, but
Right.
ultimately the laboratory, and this is my firm understanding, that he has to be complementary to the clinician, but the clinician, IVF is not a lab line. IVF is a clinical line which has got a lab part in it also. If, for example,
Correct.
if there's a cardiac surgeon, he's doing a bypass, he needs a cardiac technician to run the cardiac machine as well. Or there's a general surgeon, he needs an anesthetist to run his anesthesia. Without the anesthetist, he can't operate, he can't do a surgery. Similarly, a IVF clinician needs an embryologist to run his clinic as well. So they are complementary jobs. However, it still is a practical line, because IVF is a 10% of infertility. 90%
Right.
of infertility is can be treated without IVF. So it's a subset of the general treatment of infertility, which so it's a among the bouquet which is offered to the patient of infertility. It is a part of that bouquet. It's not, and then now we are expanding our application of IVF. It is now going from IVF to egg freezing also, or
Correct.
freezing of fertility. It is also
Right.
going to find out about genetics and trying to give genetically normal children to the parents. So
Correct.
the expansion of IVF is going to become better and better, larger and larger. More applications of biotechnology will come in as we
Right.
go along.
Right. So when you say implementation, and if I understand you correctly, it will be actually a hand-in-hand work of both the embryologist as well as the clinician
Right,
to
right,
actually drive standardization in the IVF process.
right, right. So the
What are your
embryologists are very important for us. Without them, we can't exist. It's a coexistence between the
yes,
clinician and the embryologist.
yes. And what are your thoughts about insurance? Because that still remains a debate in India, and I think that is something that would really help millions of couples. While there is access, but then when it comes to affordability, not everybody can afford. And as you said, even the positivity rates or live birth rates are just 30 to 35%.
I think
What do
that
you
you know
feel?
what, if I was an
When
insurance company, yeah. So if I was an insurance company, it's a fantastic thing, because you give them a cover and you say that when you get married, you take this cover, and if in 5 years time you don't get spontaneously pregnant, then only we will apply the insurance. You
right,
understand?
right,
So the company will be a win-win situation, because you can't have a company, insurance company, which can lose money on this. At the
right,
same
right,
time, you
right,
give a premium, so you have a
right,
normal premium, and you say, okay, at the time of marriage, we will
right,
issue a insurance premium, but it will
correct.
be operational 3 or 4 or 5 years after the fact. So
Hmm.
in which,
Yes.
because IVF will be needed for how many people? Suppose there are 100 people who take your insurance. Out of the 100 people, 10 people will be infertile.
So we can't hear you.
Yeah, can you hear me
Yeah.
now?
Yes, yes.
So out of that 10 people, 10% will need IVF. So in that, those 10%, so 110%, so one will need IVF. So if you give an
Correct,
insurance cover for IVF, and you say that, so the insurance will get 99% patient's premium, only they have to pay for one person, then it
correct.
becomes viable.
Right. So, sir, so essentially, this is something wherein, all the bodies, including Foxy, ISAR, etc., need to somewhere work with the government to get this going. So, is this maybe one of the agendas that you think these bodies will take up in the near future
Yeah,
so that
I
the
think, yeah,
affordability
yeah,
can?
I think it's a fantastic. I to feel that we should do it ourselves. Why we need
Right,
insurance? We
right,
all get together and we offer this premium to everyone.
right,
But
right.
there are a lot of regulations of insurance companies, and you need minimum 150 crores or whatever. But I'm just saying it's a fantastic idea, and if it is very easily implementable, not only it will help the companies, but it will help the doctors, and of course, the most important, it will help the patients as well.
Patients, absolutely. Absolutely. So, what do you think, sir, in the last 1 year has changed? So, we've read so much in the newspaper, it has impacted the number of cycles. We've lost a lot of cycles due to the lockdown. Also, the natural pregnancy rates we've heard have gone up in general because of the lockdown. So, across the IVF industry, what are your thoughts in terms of what has been the real impact of COVID, on the entire IVF industry in India?
The immediate impact of IVF has been, there was a fall in the when there was a lockdown. Suddenly, we had to stop the work, so there was a lot of impact as far as income was concerned, and there was no patient for 2 months. But now the patient load is around 40% of the norm original. Okay, but
Right,
what
right,
happened is, at least in our group, we trimmed down our workforce. We have made it more. Now, last 3 months, I have had done nearly 1,000 cycles of various things like embryo transfers, frozen transfers, IUIs, etc., etc. So, what I have learned a lot. So, the COVID has been a learning process for me in
Right.
terms of minimizing the. See, initially, what used to happen? Patient used to come to us multiple times. They used to come. Then, when they started IVF, they used to come to us for ultrasound monitoring. So 4-5 times they had to take. Then they used to come
Right.
for taking the injection. Now everything we have made it so streamlined. So they come to us only once.
Yes.
So the teleconsultation is on the video consult. After that, we tell them to do the tests that are done by we send the technicians home to collect the blood. In fact, one of the labs is even collecting the semen home and bringing it and doing the testing for a charge, because they have to bring the semen immediately back by Uber or something to the lab. So all the tests are done at home now. So the patient doesn't have to travel. Second
Right.
part is that when we do the stimulation, medicine is given and delivered at home.
Right.
They don't have to come to this thing. There's a VFAST service. The prescription is given of the doctor, and medicine. Once the prescription is given, they pay for it and the medicine is delivered home. The medicine monitoring of the cycle. Originally, they used to come to the clinic and monitor. Now, so many India, there's a huge amount of sonologists all over the. Let's say in Mumbai city, everywhere there is a sonologist, or in Delhi. So we send them to the local nearby sonologist to
Right.
monitor. So after
Right.
they are ready, the last they take the injection, and only for the oocyte retrieval, only one time they come. So what
Mm.
we are going to do is we are going to continue this practice now, because
Correct.
what has happened, it has become very patient friendly.
Patient
See,
friendly.
and now patient
Actually,
can see
movement
what
in
happened.
the direction of what we say mobile IVF, sir. Do you see
Yeah.
that as something that is a possibility?
In a way, but in India, like every city, when my brother-in-law is a gynecologist in USA, so there he's got a hospital and it is in a country setting. So every 4 or 5 days there's a big trailer with a CT and MRI. They come to his
Right.
hospital and the MRIs and CTs are done. So maybe at some point in time in India we'll have a trailer with the IVF lab inside.
The IVF lab, yes.
And
And
but
what do you,
huh?
so please go ahead. Please go ahead.
No, no. So, but in India, anyway, the installation costs are so not that costly that almost everyone in all, even smaller cities, IVF is not available. So I don't
Correct.
think, and the trailer you need good roads so to take.
Yeah,
So
that is
it's a big
also that's
problem.
also true. That's also so. So, sir, from a lab perspective, let's say, so you said that essentially one of the steps that has happened due to COVID is that the number of times the patient used to come to the clinic or to the doctor has decreased, and it is very patient friendly because they don't have to travel. Obviously, all the mental tension that they would anyways be having. What is it that is needed in the lab to take care? Now, looking at we talk about social distancing, we talk about all the precautions. So what do you think are the key precautions that a lab should take to ensure that everything is safe and top quality, especially during these times?
So no, the labs number one is that they have to be air handled. So we have air handling units. We change the lab air every 10 minutes. So in 10 minutes, outside air is brought in through HEPA filters. So and the temperature control. So that is the basic thing. All labs have to be air handled, because then even
Right.
if the embryologist see the fear of infection in during COVID time, and this COVID is going to stay with us for the next 2 years or so.
Correct.
It's
Correct.
not so much from the patient, because what we do is that we do triage, and at the time of the starting of the patient is tested for RT-PCR, and then on the 9th day before we give the final injection, we do another test for patient and husband. So the patients are fully screened. If there's a positive patient, we cancel the cycle. The main worry is not the patient but the staff, the
Right.
anesthetist, the sonologist, the ward boy, the nurse, the embryologist, the doctor. These are the people who may get infected, and they may pass on the infection to others. Say, for example, in the lab, there are two embryologists. One of them may get infected and may pass on the infection. They'll not get infected because of IVF. They may get infected because of their routine work outside. And
Absolutely.
then while traveling, they may get infected while going to
Right.
the toilet somewhere. So that is the thing. So you have to have internal social distancing. So we have told our people that if you have any symptom, you must immediately report. If there's a
Right.
symptom, we'll do a test. And that is that has to be ethical. It has to come from within. You should not hide anything. And I've told them that if there is a symptom and you are going to stay at home, we'll reimburse you. We'll give you your full pay. So don't worry that you will have a job loss or you will have a pay loss. So that's very important to assure them that there is no problem. Second thing is that in the lab, we try to minimize it by having only one embryologist. So that's why witnessing systems are important now, because whenever we do IVF and all, we have normally two embryologists so they can witness each other. But now if we start having one embryologist, then we will have to have some machine-based system which will act as a witness to prevent any mix-ups in the lab. So in the future, I foresee that if we minimize the number of people in a lab, then we will have to replace them with more amount of witnessing systems, electronic witnessing systems, which are now available, which can tag the patient so that we don't have mix-up. One embryologist working in the lab may get overburdened and do some mistake. So I also told them that you must have two embryologists, but at one time see that you keep distance between the labs. See, most of the labs have been small for us. So this has to be changed now, that way.
Right. And I completely agree with you, sir. I think that is absolutely essential for the safety of the embryologist, more than, essentially of the sample, let's say.
So what I've also done is they wear PPEs and they are in AHUs. And what we have done is that we tell them not to share the microscope. So for example, if there is two main microscopes in the lab, one stereo microscope and one inverted where the ICSI is done. So a particular embryologist will only use one microscope, because if they use, their eyes can transmit. So if at all they have to share a microscope which has been used by someone, they have to wipe it down with alcohol before using it.
Right.
So that's very important. Plus they wear gloves and all that. And plus we have a triage system every day. If they have any positive triage, we do RT-PCR, and we have a quarantine system in place also. Plus we have divided our groups into teams. Ours is a large group. So we can have a team. So one team is at home. If someone gets infected, the one team is retired and the second team comes and does the surgery.
So when do you see, sir, a recovery? Let's say you said that the number of cycles, of course, went down.
I feel that now there is a second wave will come. So the recovery will take place over the next 1.5 years, I feel, because we are going to have these waves of thing till the infection is stabilized and the virus gets attenuated, either by repeated infections or by vaccines, which we have seen in the past pandemic, Spanish flu, that it took 3-4 years to ultimately disappear. So, the virus is in a very toxic form. It needs to be, over the years, it will get, as it passages itself, it will become more and more attenuated. So this next 4 years, 3 to 4 years are very turbulent years for us. So in fact, I personally feel a lot of the change that are coming in now is not a right time for, newer IVF chains and all to enter, because they will all crash, I feel. Because the problem is not the patients are there, but the fear is there. See, there are two types of medicine we have in our life. One is what is known as emergency medicine. In fact, I was listening to one seminar where the cancer doctors were there. They were saying that the cancers are being missed out. People are coming at late stage. And one cancer doctor was saying, because that 1% fear of mortality in COVID, you are having a 10% mortality in cancer. Because the stage of the disease is advancing. By the time they come, the disease is advanced. So all these issues are there. So the elective work is getting affected. The elective work is made up of health checkups. Health checkups are getting affected. Because of that, more people are landing up with more trouble, disease, cardiac disease, strokes, cancer. And the other work, which is very important for the medical fraternity, is the non-elective work. Hip joint replacement, knee joint replacement. Now, suppose you have got pain. Now you can live with it, no? For 3 more years before you do. You would have normally not lived with it. You would have done but now you're scared to get operated in the hospital. You say, no, I don't want to go. Same with IVF also. They say, no, after 2 more years will. So what we are getting for 70%, though now patients are stabilizing, but 70% of my work is what is known as emergent work. Means patient with a low ovarian reserve, AMH less than 1.5, patient with older age group, more than 35-year-olds, patient undergoing cancer who need to preserve their fertility. All these patients are coming.
Okay.
The
So
normal
are you
patient is
saying
saying,
that, yeah. So are you
the,
saying that it is actually not the right time to for the investors to invest in the Indian IVF market? While the normal, the normal thing that is discussed is India is a lucrative market with a good growth, of course, contributed by the lifestyle changes that are happening in India, plus medical tourism. So are
no,
we
but
saying
I
that
think that,
maybe 1 or 2 years is not?
yeah, it is not
Yeah,
a right time, because the point is that 50% of the people are not coming out of fear of getting infected.
correct.
So the 50% who are under pressure, like they have a low AMH, ovarian reserve is low, AMH less than 1.5. AMH means antivalerian hormone.
Yeah,
My
yeah.
age is 35, 37. I have to get a pregnancy. I'm undergoing
Sustenance
cancer.
will be difficult, is what you're saying. That even if people enter, sustaining will be difficult
Yeah,
because
sustenance is
patients
very
fall ill.
difficult, and because there's some lot of degree of discounting that is going on at present.
Right, right.
So
So, sir,
this
what
is
do you
there in
see?
all fields of industry and hospitality and everywhere. So it will take us time, because the waves. Look at the European. Now the second wave is there. Now third wave will come. In fact, feel that India is doing the better thing than, let's say, New Zealand or Australia,
Yeah,
because that's a
yeah,
virgin population. Every time
right,
some virus goes in, they'll get infected. So they will
right,
be worried for next 5 years.
right, right,
Our population is getting rapidly infected, so it is
right,
going to we will stabilize in the faster time. So it's not a
right,
matter of how early we stabilize is more important. So I
right.
personally will stabilize in 2 to 3 years time, but 2 3 years are very turbulent years.
Right. So, what do you see as a future in the next 5 years, let's say, both from a clinic perspective, from a patient perspective, from an industry perspective? How do you see the future of IVF in, let's say, 5 years from now? We're talking about 2025.
See,
Despite, all this imbalance, how will things change?
so I personally feel that what we anticipated, the whole business, the whole industry, hospitality work, hospitals, we anticipated an expansion in our paying class population. See,
Right,
we have two roles, two hats. One is to do
right,
our standard work, and second hat is to do less discounted work for poor people. Our country is made up of two parts: 1.2, 1.1 billion poor people, and 200 million well-off people who can.
right,
I even tell my driver who gets 18,000 a month that he's a rich man in India. So I would say that anyone getting 15,000 or more a month is a well-off person in our country. So
uh-huh,
our job is to see that the 1.2 billion people, 1.1 billion are taken care of. Very
mm,
important. And for
mm,
that, we should even do free work. Now,
mm,
remaining 200 million, suddenly these 200 million are under stress. Our economy has not grown as predicted. In this 200 million, as it has shrunken. Their
mm,
paying ability has gone down. So what do we
right,
do now? There is only one thing which we can do.
mm,
We have to increase our inflow of work from abroad.
right,
Till the time this 100 million, this shrinking group again re-expands in 3 4 years time, and economy takes off and more jobs are made available, our pre-existing industry, the our service industry, which includes hospitals as well, which includes IVF as well, we have to expand. So we have to create bubbles. We have to create a tourism bubble where
medical
people
tourism, you're saying, will play an important role.
yeah, this is a very important, crucial for us. And we should create a bubble where they travel, they are seamlessly at the airport, their visa is done on the net. They should not even get. They should be just stamped automatically. Not a human should also stamp them. They should be directly. There should be government vehicle certified to take them directly to the hotels, from hotels directly to the hospitals, and operated and sent back. This
Right.
bubble, if I would like the government to make me the commissioner of this bubble. If I am appointed by the government, I will effectively implement it, and I'll assure you I'll give them 10,000 crores.
Mm,
All the we'll create bubbles, and all the specialties can be smoothly given, so that income will help us not only to grow the business but to help our people.
right, right.
Every important, remember, we are spending a lot of money on the Indo-China front also now. So every foreign exchange, every drop, in Marathi there's a proverb, thembe thembe tare sache. Every
Mhm.
drop is important for us. So
True.
getting medical tourism is like it's a patriotic work for our country,
Right.
which we'll do.
Right. Yes, and it'll help the entire economy in all various ways, as you said. So, sir, a little about you now. So, every time, I have met you, I have talked to you, you are always very positive, agile. You want to try something new, do something new. What keeps you so motivated and inspired always? Like, what is your mantra? And what do you think you like to share with everyone? What is it that, because every time we are talking, every discussion I've had with you, there's something positive to learn from you. It's really amazing to see you want to learn something new, you want to do something new. So, what keeps you going?
I don't know. It's just in the DNA, inherited from my parents, and like I am, basically aspirational person, ambitious person, and so and also I feel a lot because my parents both were freedom fighters. My father was in Jai Prakash Narayan movement, and he was in jail from 1942 to 46 in the Karjat jail for Chale Jao movement. He was arrested because he was an extremist under Jai Prakash, and my mother also was in jail for. So we are very patriotic nationalist people,
Okay.
mainly concerned, and so that is the one part. So I'm all the time want to do things, and as president elect of the Federation of Gynec Societies of India, I'll become president of Foxy in 2022. Foxy is made up of 38,000 gynecologists, and we sit in all the boards of the government, all the policy making as far as women's health is concerned. We are very important players. So I am very keen on integrating healthcare, bringing all the dots together. Everything, every woman, we should integrate her. And 1.1 billion women which we have, we have to population all the women. We should give totally discounted care, according to me, or even free care. And as I told you, our earnings should come from the 200 million at the top and the medical tourism that will come from the. So this is my concept which I want. So coming back, so that this all the DNA, it's in the DNA, one of the best things I personally feel when I look back is that I have this forgetfulness. So I forget anything negative that has happened in my life. So within a week's time, I forget. So it's good
Right.
because you don't keep anything in your mind. And I'm always,
Right.
this COVID has also driven me a lot because I have been in the house and I've been accessing a lot of literature. It's been a lot of learning experience. The internet. I believe in there are two parts of internet. One is the information part,
Right.
and the other is
Right.
the expression part. I
Yes.
am not happy with the expression part because I feel it can create a lot of discord in the population, but the information part is very important. So I am a part of LinkedIn. Every day I get so much information from LinkedIn. The advancement on science, it really triggers me on. So if you
Right.
see in my, I buy like everything latest. Now I'm very interested in 2 3 projects. Even during this, now we are buying a new like we are putting a witness system into the lab, or we are buying a new technique of doing micro manipulation. So all the time, because I have learned this from Mr. Godrej. I had listened to his interview in 2008, and
Mm-hmm.
that was the time when there was a major downturn, and
Mm-hmm.
they were interviewing it. So he said that during the downturn you should spend more money
Right.
instead of spending less money. Companies should spend more money during downturn. So I have adhered to that. Every time I have had a stress, I have spent more money in research, in equipment, in communication, etc., to improve the footfalls and to give better service. So all these things are there, which keeps me going, I feel.
Right. So, what are your two topmost, I think, messages you would like to give to the budding embryologists and clinicians? What is it that they should follow? Like, you said you were inspired by Mr. Godrej. What do you think people should follow that will really help them be successful in life from your experience?
So one thing now I found our Indians, we have a defect of commitment. I mean like the same person. So I think something is wrong with our DNA as far as the environment is concerned. Means the same embryologist. Suppose I put him in, let's say, a lab abroad, he will behave differently. Here he is more okay. The boss will tell me and I'll do it. There they have to do everything themselves. So I feel whatever job you do in whichever place you are, you be very committed.
Right.
Do it with passion. No? Don't do it as
Right.
a job.
Right.
That's very important. You need to do things with passion.
Right.
Do research, do publication. Be in love with your bosses. Be
Right.
Then if you leave the job and go to someone else, then do so. till the time you are there, don't. And then second thing I feel is that the present generation has become too aspirational. I personally feel that growth is not a given.
Right.
Somehow now this is a wrong concept. I feel this is creating unhappiness in the world, that we have to grow all the time. Why should we grow all the time? Look at me now. I have been in the IVF field for 30 years. Why should I grow? Why can't I be static and plateau? I can grow minorly. Why should I grow exponentially and then go public and then sell my company for billions and billions of dollars? What is it going to get me? So this concept of which was there in our ancient people, they used to get up in the morning, they used to till the land, they used to come in the afternoon, then go in the evening again, then sleep. So there was you were enjoying your life in real time. So my advice to everyone is, yes, you must be ambitious, you must be aspirational, but don't lose the track of your real time life. Enjoy
Right.
every moment of it, savor every moment of it.
Right.
This time will
Right.
not come back again. Everyone is running after a khwab. What is the end point? There's no end point. So this is very important to understand.
Right. So passion, commitment, learning, and of course, balancing is what you're saying really helps. Balance your life with, of course, your ambition.
Yeah, you must be happy in your present, and but
Right.
but look at the future.
Right.
Don't be unhappy in the present. Don't lose the present. Present is very important.
Right. Right. And completely agree with you, sir. It's like always, it's a pleasure to talk to you because I get to learn so many things whenever I talk to you. I think on platforms like VOH, there are a lot of points that were raised today, as Dr. Pai said. We've talked about insurance, we've talked about, medical tourism and how it can contribute to economy. I think platforms like VOH, sir, can really help our voice to reach to the government. What do you say?
Yeah, I think that VOH is a fantastic platform, and government has to bring people like us into the implementation. They are already open to this, and let's hope that they really look at medical tourism on a large scale, because it's
Right.
a very important foreign exchange earner. It's not yet developed well. Most of the medical tourism is going to Thailand because the infrastructure is not good. So for us to develop infrastructure will take time. So let us create bubble infrastructure. So
Correct.
we are learning from COVID. So let
Right.
us create localized, focused infrastructure which will enable us to give effective medical tourism rather than looking at the overall. That will take a lot of time.
Right. Great. So thank you so much for being here. It was a pleasure talking to you, and I think a lot of new ideas for everybody in the IVF industry, both from
Thank
your
you.
personality and, of course, your experience. Thank you very much, and
Thanks a
thanks
lot.
to everyone who's joined us.
Thank you very much. And I really had a pleasure. Shipra, you really did a great job. And let's hope that
Thank you,
we
sir.
have more interactions like this in the future. Thank you.
Thank you, sir. Thanks a lot, everyone.
Bye. Bye.
Bye.